Dr. Khan Show. Thank you so much for joining me. And in this episode, we're going to talk about the vagus nerve and the 3 surprising truths about vagus nerve that you may not be aware of. Now, the vagus nerve is one of the most important nerves in the body. It runs through the entire length of your GI tract and it controls many functions. Many people associate the vagus nerve with helping with digestion, and certainly it does that. But there's a lot more that the vagus nerve does that can create problems and symptoms that you may not be aware of that can be related to vagus nerve problems. So today, we're going to talk about the 3 surprising truths about vagus nerve, and more importantly, how do we actually stimulate the vagus nerve so we can have better function. All right, so we're going to talk about the 3 surprising truths about vagus nerve function. Now, first of all, know that vagus nerve comes from the brain, or specifically your brainstem. So here's a picture of your brain. Well, let's see here actually. There we go. There we go. All right, let's see if this is working. So we have the brain. This is facing this way. This is the front. And we have the brain stem here and the spinal cord. And these are spinal nerve root that innervate every single part of the body. This area is called the brain stem, which is in the neck area, upper neck specifically. And there are 3 bumps on that brain stem toward the front. And then the lowest part of this bump is called the medulla oblongata. Kind of a funny word, but that's what the medulla is. In the brainstem, you have cranial nerves that exit the cranium. Okay, these nerves come out and innervate structures in the eye, in your tear duct, your face, and so forth, muscles and mastication. One of the nerves that exit the brainstem in the medulla is your vagus nerve. And this is cranial nerve number 10. Now, there's actually a pair of them, one on the left side, one on the right side, that go down through your neck, toward the front part of the neck, toward the side here. And it goes down and innervate every single part of your body. Well, not every part, but specifically innervate the heart, innervate your lungs, and even innervate your entire GI tract, all the way down as far as the ileocecal valve, which is where the colon starts. So the vagus nerve is a very important nerve that traverses throughout the entire GI tract. And the word vagus comes from the Latin vagabond, and vagabond means a long and wandering route. So the vagus nerve is a long and wandering nerve that wanders all the way throughout the GI tract. And the vagus nerve is part of your parasympathetic nervous system. The parasympathetic nervous system is part of your autonomic nervous system. So in your nervous system, the arrangement is that you have the autonomic nervous system, and then you have the sympathetic, and you have the parasympathetic. The sympathetic drives fight or flight response to make you pay more attention, to get you energy to get up and go. The parasympathetic is your rest and digest system to help you to calm back down after you have gone to fight or flight a bear or tiger. And so they work in opposition. This is like the gas pedal, this is the brake pedal. Now they're never working exclusively one side or the other. So it's not like you turn on the sympathetic and the parasympathetic's 100% turned off. It's more like at any given point, sympathetics and parasympathetic, they're both firing, they're both working, kind of like they're both pushing at the same time. Maybe the parasympathetic's working 60% while the sympathetic's working 40%, and then it can switch depending on what the demand of your body is. Okay, now the vagus nerve is part of that parasympathetic function. So what does parasympathetic function do as far as vagus nerve goes? Well, one of the main things that it controls, as I already alluded to, is gut function. Well, specifically, what part of gut function? Well, the vagus nerve innervate anything that has to do with GI, gastrointestinal secretion. So this will be secretion of stomach acid, secretion of enzymes released by the pancreas, secretion of gallbladder, bile release. So any type of digestive secretion is going to be controlled by the vagus nerve. Next, vagus nerve controls motility. Now, motility means the path at which your food goes through your GI tract. And it typically goes, not typically, it always goes in a north to south fashion, meaning food goes in your mouth, goes down, and come out the other end, right? If it comes up the other end, that's regurgitation, that's reflux, or even vomiting. And that's usually something that happens when things are not working properly. So normally you want to have this downbeating motility or peristalsis where food is moving down through the GI tract. Okay? And that way you can have proper bowel movement as well. So that controls bowel regularity and then also controls valvular function. Again, because food is supposed to traverse from north to south, so along the way, there are muscular valves that control the passage of food. So when the food gets past a certain point, it doesn't regurgitate back up. For example, the transition from the esophagus to the stomach, there's a lower esophageal sphincter. So once the food enters the stomach, the sphincter can contract so the stomach acid and the food in the stomach doesn't reflux back up. And as you go lower, for example, from the transition from the small intestine to the large intestine, we have a ileocecal valve. So again, that's so that food, as it transits into the colon, where there's a lot of bacteria, like they're supposed to be, that colonic stool fecal content doesn't regurgitate back into the small intestine. That can potentially create problems. So if your vagus nerve is not functioning properly, then it can cause digestive symptoms. What are some of these symptoms? Well, if it's problem with secretion, then it will lead to indigestion, right? Because you're not making enough stomach acid, you're not producing enough pancreatic enzymes, you're not producing enough bile, then the digestion of protein, fats, and carbohydrate may be compromised. Then you may feel indigestion, you may feel gassy and bloated, because when food is not being digested properly, it starts to ferment, and that fermentation creates gas, so you feel the bloating and the abdominal distension. That can be coming from a digestive secretion problem. Also, you might see undigested food in the stool. That could be a digestion or secretion problem caused by a lack of vagus nerve innervation to your GI tract. Next, if you have malfunctioning vagus nerve or decreased firing of the vagus nerve, you may have motility problems. What that means is food does not transit down from north to south as it normally would. And when that happens, you might experience regularity problems, such as feeling constipated. Maybe you go to the bathroom every 2 or 3 days and you say, oh, it's been going on for a long time. I thought this is normal. It's not normal, right? As you eat, the food's supposed to transit through. If you eat, 2-3 times a day, you should have at least 1 to 2 and maybe up to 3 bowel movements per day. If you go every other day, it's not normal. And some people, they go once a week. That's very abnormal. And that may be a vagus nerve problem. Motility problem can also cause another condition called small intestinal bacterial overgrowth, or SIBO. SIBO is a condition which stands for small intestinal bacterial overgrowth. This can be caused by bacteria that overgrow in your intestinal tract. And those bacteria that overgrow will ferment against the food that you're eating, therefore creating a lot of gas and bloating and IBS symptoms. Now, SIBO can be caused by motility issues. The reason is because if the food doesn't go down, it just gets stuck there because you have lack of motility, then that food has more chance for the bacteria to ferment, right? Anything that sits there, if you ever leave, some raw meat on the kitchen counter, you don't refrigerate it. What happens to that raw meat? It goes bad, right? It can smell bad because bacteria sort of grow on the raw meat. But if things are flowing through you, right, like a river, if it keeps flowing, then things are moved out of your system. If it becomes stagnant, then you're leaving it for more chance for infections. So that can lead to either bacterial overgrowth or even fungal overgrowth, candida and so forth. So motility problem can lead to some type of gut dysbiosis where you have overgrowth of certain organisms. And lastly, it's a valvular problem, right? Because the vagus nerve controls muscular contraction of your GI tract, which includes the valves that make sure food are going down and doesn't regurgitate back up. So if the valves are not working, you may experience reflux, right? You may experience small intestinal bacterial overgrowth as food regurgitate back from the large intestine into the small intestine. Therefore, microbial content start to spill into the small intestine where it should be relatively sterile. Now you have infection or dysbiosis in your small intestine. So that's what happens when you have vagus nerve problem. It can seem like you have indigestion. You can have trouble digesting protein, fats, and carbs. You may have gut dysbiosis and gut infections and constipation and regularity problems. You may have gas and bloating and you feel like you have tummy pain because food is just stuck. This can all be due to a vagus nerve problem. Now, obviously, it could be due to something other than vagus nerve problem, but this is something that's often overlooked by conventional medical doctors and natural alternative providers alike. Now, the next problem, or a surprising truth about vagus nerve, is that it also contributes to brain function. So most of you may have heard of what's called the gut-brain connection. Research is very clear now that the gut and the brain is a bidirectional superhighway, not only controlled by the vagus nerve, there's nerve innervation from vagus nerve from the brain to the gut, and then back from the gut, the vagus nerve also have pathway that goes up to the brain, and that communicates what's called enteroception. Entero means intestinal tract. Interoception is your awareness of your internal organs, especially in your intestine. And we also have what's called the enteric nervous system, which is the nervous system, all the nerves that innervate your intestinal tract, that control the motility and the muscular contraction. And this interoception is vitally important because it signals to the brain what is going on in your gut, what is going on in your body. It's like a monitoring system, except it's a vast network of monitoring system that communicates through different peptides, different cytokines, different chemicals, different bacterial fermentation compounds like short-chain fatty acid. And all these chemicals are communicating back up to the brain to let the brain know that, hey, my digestion is working, everything is normal. There's no infections, there's no pathogen that's disturbing things. And that's vitally important. Now, the vagus nerve also contributes to relaxation and mood. Remember, we talked about the sympathetic and parasympathetic? They're opposing function. They're constantly opposing each other, kind of like the yin and the yang. They're constantly pushing. And depends on which one's more dominant, that's going to be your dominant physiological state and even mood states. So if your vagus nerve is not working very well and the vagus nerve promotes parasympathetic function, which is more of a relaxation state, so if your relaxation state is more inhibited due to a lack of vagus nerve function, then you may have more sympathetic fight or flight states and experiences. You may feel more anxious. You may feel more restless. You may feel like your heart is beating faster and you don't know why. There's no reason for you to be anxious, but yet you're anxious nonetheless. So you may impair your ability to stay relaxed. That may affect your sleep as well. So that's how that can impact brain function and your mood. The reason it can impact mood is for the same reason I just stated with the sympathetic and parasympathetic, but additionally, if your gut microbiome, the bacteria that lives in your colon, that's normal, that's supposed to be there, is disrupted, and you have a state of dysbiosis, which means that the bacteria in your gut is in the abnormal ratio from what they're supposed to be, that can start to produce chemicals in a different ratio than normal as well, right? See, there's bacteria that are supposed to be in your gut. They produce a normal amount of chemicals from the food that you eat, and that drives your normal state of function, mood and behavior and cognition and so forth. If you have irregular or abnormal ratios of different bacterial population, due to the food that you're eating, due to stress, due to the activity level, lack of exercise, due to antibiotic use or environmental toxins, blood sugar problem, all these issues can cause dysbiosis. And now you have abnormal populations of bacteria producing abnormal amount of chemicals, then therefore you can start to cause abnormal mood, like anxiety states or depression states. So this is where most of the research in the gut microbiome is really pointing to this brain-gut connection, in that gut dysbiosis and abnormal gut microbiome can drive alterations in brain function that can lead to anxiety states, depression, and so forth. And so vagus nerve can contribute to brain function. Another thing that can happen here is that the vagus nerve actually is a transport system. transport, meaning the vagus nerve literally is not just an information superhighway that transports nerve messages back and from the gut to the brain. It also transports different chemicals. It also transports cytokines and even toxins that can get into your system. That transport, that roadway, can be a way for infections and toxins to kind of hitchhike on that transport superhighway and get from the gut up to the brain. And once these infections or toxins get from the gut to the brain through the vagus nerve, then it's going to start to cause brain inflammation, and that can drive eventual neurodegeneration, which means that your brain cell is dying at a faster rate due to toxins, infections, and inflammation. And that can turn into things like Alzheimer's, dementia, various forms of dementia, including Alzheimer's, Parkinson's, and so forth. Research is now very clear that Parkinson actually starts in the gut. In fact, Parkinson can start in the gut about a decade or two before even tremor starts to happen. So we have to mind the vagus nerve, we have to mind the gut function, and we have to mind brain function by seeing the connection between them all. Now, the last thing, the surprising truth about vagus nerve, is what ties the gut and the brain together, and that's immune function. You see, your vagus nerve is hardwired to control your immune function. Specifically, it's able to dampen inflammation in the intestinal tract, in the liver, and the spleen. This is such a hardwired response, okay? It's not an indirect chemical response. It's a hardwired neurological response where your nervous system, through the vagus nerve, directly controls inflammation level. This has been called in the research the inflammatory reflex. Now, why is that important? The reason is reflex is a term that's reserved for some type of automatic process, right? So like you go to the doctor, they tap your knee with a reflex hammer, your leg kicks, kind of funny. Hey, tap the knee and it kicks, because that's called a myotatic stretch reflex. You tap the patellar tendon, it causes the muscle to stretch, and there's a spinal cord reflex that causes the muscle to contract automatically. That's the patellar reflex that the doctors do with a reflex hammer. So anything in the body that happens automatically is called a reflex. So this brain control through the vagus nerve, controlling inflammation, specifically dampening inflammation, lowers it, is actually a reflex. It means that it just happens. Meaning if you have good vagus nerve function, it automatically helps you to dampen inflammation in the body. Therefore, lack of vagus nerve function means that you cannot dampen inflammation, specifically in the intestinal tract. So that can cause a leaky gut, that can cause inflammation in the gut and dysbiosis. In the liver, you can have more inflammation, which can make it difficult for you to detox, difficult to process sugar and glycogen, as well as difficulty processing fat. And then also in the spleen. The spleen is a large lymph organ that's the site of where a lot of your immune responses are produced. In fact, most of the circulating macrophages and these TNF alpha, these inflammatory signals, are actually produced in the spleen when you have a systemic inflammation. So the spleen contributes to a large portion of the body's total inflammatory response. And if you can't dampen that inflammation in the spleen, then you're going to have systemic inflammation. This is where you might experience achiness. You just feel like your body's inflamed, like you hurt, and you may have more joint pain or muscle pain. Now, in addition to pain, inflammation can show up as other than pain. For example, inflammation in the brain can be perceived as fatigue or brain fog or depression. So it depends on what tissue is being affected. You may have different symptoms, so it's not always just pain in your spleen, not necessarily so. So those are the three surprising truths about vagus nerve function, in that it controls gut function, but not just digestion as it relates to secretion, also motility and valvular function, which when malfunctioning can lead to overgrowth of bacteria and candida and dysbiosis. The vagus nerve controls brain function in that it communicates information from the gut to the brain, so that's interoception. It controls relaxation and mood through the microbiome's production of these not electrolytes, but metabolites that has an impact on brain function, and also through the parasympathetic and sympathetic opposing function, so that help you to stay in a relaxed state. And then there's also transport mechanism from the gut to the brain through the vagus nerve, where toxins and infection and alpha-synuclein plaques can be transported through the vagus nerve, and that can eventually end up in the brain and cause neurodegeneration that can lead to Alzheimer's dementia. And lastly, vagus nerve can impact immune function by dampening inflammation, which is a good thing if you're inflamed. And if you don't have vagus nerve function, you're going to be more inflamed than otherwise. And this could be a reason why you're taking supplements for inflammation. You're doing everything you can to reduce inflammation. You're trying to eat good. You're trying to do this and that, but it's still not working. The final piece of the puzzle may be vagus nerve function. Now, let's talk about how do we actually stimulate the vagus nerve? How can we make the vagus nerve function better? Well, you're going to hear this message from me over and over again, that we must identify the root cause. What's the reason why the vagus nerve is not functioning well in the first place? And that may be another episode that we're going to talk about more in depth about the root cause. But to stimulate the vagus nerve, know that the vagus nerve comes from the brainstem. It exits through this area in the ear here. It's under the skin, and it goes through the front of the neck. Again, there's one on each side. And then once it gets down in the chest cavity, it starts to innervate the heart and the lungs, controls blood pressure, controls your gut. So how can we stimulate that? Well, understanding that it comes out of your throat and it actually has innervation to your throat muscles and swallowing muscle, and also it controls the gag reflex. The gag reflex is when you go to the doctor, they put a tongue depressor, push down on the back of the tongue, and it causes you to like have this gag reflex. Why did they do that? Because they're checking for the function of the vagus nerve. They're saying if that vagus nerve is actually working or not. So because the gag reflex is controlled by the vagus nerve, therefore you can do the gag reflex to stimulate the vagus nerve. See, in neuro rehab, the way you stimulate a nerve or a certain region of the brain is by doing exactly what that particular nerve or that region of the brain controls. If you want to stimulate the eye movement system, you do eye movement exercise. If you want to stimulate balance, you do balance exercise. If you want to stimulate the vagus nerve, you stimulate whatever the vagus nerve will control. In this case, gag is one way that we can access the function of that nerve and thereby stimulating that nerve. So you can do gag reflex exercise. And how do you do that? Well, practically speaking, at home, when you're brushing your teeth, right? Hopefully you're brushing your teeth every day, at least twice a day, I hope. While you're brushing your teeth, you can simply just use the toothbrush, push down on the back of the tongue. Now, don't poke the back of your throat because you'll hurt yourself. Just push down on the back of the tongue, and that will induce a gag reflex. Now, how often should you do it? Well, you should do multiple reps. Just like in the gym, if you're going to do a workout for bicep curl to build up your bicep muscle, you don't just lift the dumbbell once and put it down and call it a day, right? You got to do it repeatedly to get enough stimulation of that nerve. So in general, I recommend you do 3 to 5 reps, maybe up to 10 reps. And the way that you want to monitor this is that if you get a tearing response, right? Sometimes you yawn or you gag really hard and tears come out. The reason is because what lives next to the vagal center in the brain is an area, the nucleus, where the tearing response comes from. So if you're stimulating the vagus nerve really strongly, it'll kind of hit the neighboring neuron that also stimulates tearing response. So if you do the gag reflex and your tears start to come out, then you know you've probably done enough because you fired enough response to affect the neighboring neuron. So that's one way to tell. Another vagus nerve exercise is on a similar vein. Instead of gag, we can hum. So humming is an activity that's controlled by the throat muscle, the vocal cord. So again, the vagus nerve has branches that goes to that area. And when you hum, by the way, it's not just the motor action, but also the vibration of the humming of the vocal cord is a sensory stimulus, and that also can stimulate the vagus nerve as well. Now, when you're humming, what you want to do is you don't want to just hum like, and just gave up on it. You want to hum pretty intensely, okay? So when I say hum, I really mean like singing loudly, diaphragmatic. You can hum, but it's got to be very intense. Like with any kind of exercise, the intensity matters, because if you're trying to grow your bicep muscle and you lift like a 1 pound dumbbell, where your capacity, you can lift 20 pounds, but you're lifting only 1 pound dumbbell, then the 1 pound dumbbell is not going to be heavy enough to stimulate something to cause growth. So you got to do it intensely enough. So when you hum, really give it a big belt and hum, right? If you did this in a supermarket line or in a line in a bank, standing in line, and you just belt out and hum, people will look at you like, what's wrong with you? And then you get viral videos because you're humming so loud. That's what you're after. That's what you got to do to accomplish the mission. So I recommend you do this in the shower or when you drive in a car by yourself so you're not disturbing anybody else. A third type of vagus nerve stimulation is gargling. Again, you can do the same thing when you're brushing your teeth. While you're brushing your teeth, you can just, you're rinsing out your toothpaste anyways, so you can do the tongue depressor exercise and you can gargle to rinse out the toothpaste. And when you gargle, again, multiple reps, maybe a cup of water, you want to gargle that water so that the whole cup is gone. Maybe you take 5 to 10 gulps, right? One gulp, one gargle, spit it out. Another gulp, another gargle, spit it out. Do that 5 to 10 times until the cup of water is gone, and that might be enough. Again, when you're gargling, make sure it's really intense. Don't be kind of wimpy about it. Don't just like, done. You want to gargle really intensely. Take a deep breath in and gargle until your breath runs completely out and go, almost didn't make it. Another sip, do it again. Okay, so that's your vagus nerve exercises. Now, you can also stimulate the vagus nerve by promoting parasympathetic function. That might be done through meditation. You can also do heart rate variability exercises. What's heart rate variability? Heart rate variability is the changes in a heart rate during breathing. So when you're breathing in, your heart rate actually slows down. And when you breathe out, your heart rate actually speed up. So that change in heart rate is called heart rate variability. A good vagus nerve function is one where your heart rate variability changes. The reason it changes is because you're breathing slowly. So really it's tied into breathing exercise. So if you take a slow deep breath in, maybe take 5 seconds in, 5 seconds out, and you can do it even longer, 10-second in, 10-second out if you're able to. The slower you do this inhale and exhale in a rhythmic way, the more you're going to promote high heart rate variability because your heart rate is going to be tied into your breath rate. And as the breathing rise and fall, your heart rate will kind of increase and decrease as well. And that promotes vagus nerve function. So breathing exercise is a great way to promote parasympathetic function and therefore vagus nerve function. Coffee enema is another way to do it. So when you do coffee enema, the act of holding the fluid is a sensory stimulus because you're feeling the fluid in your rectum from the coffee that you're putting in there, and that stimulates the vagus nerve. But also the coffee itself. The coffee will stimulate the nicotinic receptors within your intestine, within your large intestine, and that nicotinic receptor is a nervous system signal that can actually help promote vagus nerve function and also stimulate bile flow. So this could be a great way to promote digestion. So coffee enema can be one avenue to stimulate the vagus nerve. And then from a supplement perspective, are there supplements that you can use to stimulate the vagus nerve? Well, yes and no. So here's a little surprising truth again. So know that vagus nerve function is controlled by this neurotransmitter called acetylcholine. And another way that we say it in medicine is that it's cholinergic, meaning it's using acetylcholine as a neurochemical to help that nerve function. So because vagus nerve is cholinergic, or that it uses acetylcholine for function, we can take supplements that can promote acetylcholine, meaning these are cofactors and nutrients that are used so that your body can produce more acetylcholine. So this will be alpha GPC, L-carnitine. Huperzine is an herb that can also promote acetylcholine function. So these are the nutritional support that we might consider. From a dietary perspective, we want to increase the intake of choline-rich food because acetylcholine, it's got the word choline in it, and choline is actually a nutrient that comes from fatty foods, specifically from egg yolks or animal products. Plant sources will be soy lecithin and soy fat. So you can increase the intake of choline-rich food, take supplements that promote cholinergic function. That can be a great way to provide the raw ingredients for you to make the neurotransmitter that can support vagus nerve function. Lastly, TVNS, which stands for transcutaneous vagus nerve stimulation. Now, transcutaneous means it's through the skin. Vagus nerve stimulation, meaning we're using an electrical impulse to stimulate the vagus nerve through the skin. Now, this has been done in research quite a bit and it showed some really promising results. Initially, vagus nerve stimulation was done exclusively through an implant. So they kind of have to open you up here, implant the electrical device, and then the vagus nerve the electrical wire wraps around the vagus nerve, and then the doctor can use an iPad or some type of device to control how much electricity to discharge. And this has been FDA approved for 40 years now for the control of seizure and also for depression. Okay, but that's the implant device. The negatives of that, it's nobody really wants an implant device unless you really, really have to, because it's difficult to go through the airport, right? You have to go back for the doctor to have regular checkup. You can get infected. So there's cons about it. The pro about it is that it's very specific, but it comes with it a high cost. So the transcutaneous is a way to use electrical stimulation over the skin. You can do that through the ear with an TENS unit. There's also commercial devices on the market that you can purchase that you can stimulate the vagus nerve through this area that I've personally used with my clients and has seen some great results. So that'll be a future episode where we'll talk about vagus nerve stimulation through TVNS. But for now, the big picture is that the 3 surprising truths. Now you know that the vagus nerve controls gut function, brain function, immune function, and some easy ways for you to stimulate the vagus nerve without going through a big hassle, very natural ways. Hopefully this helps you. Again, go and learn more about vagus nerve, and we'll have future videos that's going to dive more in depth with this topic. Thank you.